Please clarify.
The Minister for Health, Dr. Jane Ruth Acheng, has urged members of Parliament and other stakeholders to make enough research on whether the country needs to legalize the use of narcotic drugs before the Narcotic Drugs and Psychotropic Substances Bill 2023 is passed.
And this is what has been going on in relation to cannabis and many of these substances that cause addiction. While many countries are interested in growing, Chair, I want to implore this committee, even if it is a desk research, go to your Google and look at the countries that have legalized the manufacture, the production and manufacture of cannabis and khat. Go and look at their economic growth and their GDPs, and you will answer yourselves. You can take examples of countries in Africa, Malawi, Lesotho, whatever. Look at their economies and look at how much khat and cannabis they are growing, and answer the question whether it really improves economies. And then you look at the disadvantages that you face if you relate it to the example she gave of Thailand, where abuse goes up and medicinal use just increases by a little bit. And then you can answer the question whether it is actually worth it.
The Executive Director of Tabika Hospital, Dr. Juliet Naku, weighs in on the dangers of legalizing narcotics and psychotropic substances.
And risky sexual behavior among adolescents. These things come out of these studies that we talked about. Risky sexual behavior among adolescents with an increase in sexually transmitted infections and teenage pregnancies. So as we control sexually transmitted infections, we should think about what is underlying, so the antecedents, and deal with those as well.
She says countries that have done so are already facing serious negative consequences.
In Thailand, this was legalized 2020 to last year. This is a recent presentation that was made recently in Geneva, actually. Within 7 months of legalization of cannabis use for medical purposes, there was significant increase in non-medical use from 4.3% to 25%. That is in Thailand. And there was insignificant increase in medicinal use, the purpose for which it was legalized. The increase was insignificant, just 1%. So everybody went out for recreation. In Sweden, this is what has been found, that heavy cannabis use increases risk for schizophrenia. Schizophrenia is a severe mental disorder. A lot of these people end up in Botabika for admission, for long-term admission. So this depended also on the amount and number of times one takes it, but the numbers go up. So these are things we are seeing elsewhere. Some of these countries we want to benchmark on, they are having problems.
The Health Committee be brought on board, especially on the issue of psychotropic substances. As most of you are aware, most of these commodities are used in the health sector, and it would be a big oversight if we did not give our input and we only left it to more of the legal aspects and the punitive measures surrounding possession of narcotics and psychotropic substances. So I think the speaker guided well.
The substance use disorder, I'm being corrected. But these people, according to the bill, somewhere they were supposed to be punished. And my argument again was like, these are really patients who need help, who should be rehabilitated. And I'm also glad that you have answered it well. I hope it will find place somewhere that these people are not stigmatized.
So, yeah, one of our own children, 27-year-old, I think university, who dropped out of school and as a result of abuse of these substances. And finally, I think they are now in police custody or something. Yeah, they are in prison. So it is already affecting us, and one wouldn't want to see some of these substances legalized.
Adia Nakote, UBC.